Analysis is of Tom's standing postural observation. Go through the list, starting with his anterior view as per the sheet we were handed out in class. Firstly, side shift, or the presence of side shift. Now, I neglected to mention this because to me it seemed apparent due to his left arm window, or the size of it, compared to his right. Further, during my analysis, every highlighted bony landmark sits distally on Tom's dextal right side. Further, his left axilla tracks proximately over his second metatarsal, while his right sits laterally toward his fifth metatarsal. His left acromioclavicular joint sits fractionally proximal to his right, but relative to both the tibial tuberosity and his medial malleoli. Now, I also neglected to mention Tom's shoulder girdle. Now, like his arm window, I was ignorant in assuming that his glenoid-humeral joint would be stable based on his visual appearance. Tom did mention to me an old injury to his left shoulder, but motion more towards his scapula, which muscles also could play a role in, especially the rotator cuff muscles, in the stability of his glenoid-humeral joint. So fortunately, we have the function and mobility test in the upper extremities S7MA test coming up. I did see, however, no visible rounding of his shoulders or glenoid-humeral instability. The palpation of Tom's iliac crest, although hard to detect in the anterior view of the video, did feel to me as if it had elevated displacement. Now, this may be due to his stance with his left foot posterior to his right on the coronial plane. His knees need little explanation. There's a definite valgus stance which could be in relation to a weakening of his tibia collateral ligament. Lastly, on the anterior side we looked at his feet, and I used his tarso-metatarsal joint as the midline point, which I could only fit one knuckle under, the medial longitudinal arch, but when he consciously inverted his foot, I could feel more. Further analysis could and will be made of his feet in later videos.